There's been mixed reaction to the signing of the bill. Some organisations and opposition parties, as Junior just mentioned, threatening legal action. Newzroom Afrika's Veronica Makhoali spoke to some Joburg residents about their understanding of the bill.
A central issue among some residents is the future role of private healthcare once the NHI is fully implemented. According to the bill, some residents in lower income groups will be able to use private practices and visit private hospitals funded by the NHI fund. While we spoke to some residents in Tembisa who shared some mixed reaction to this.
Because of the Sagma election, by us promising things, but after election, I don't think it's private for free. It's unbelievable.
I think actually it's going to help a lot of people. It's going to be fair on more of them, and it's going to add more of equality on people.
Well, as you heard their residents speaking about the fact that this could be somewhat of an ANC electioneering campaign. Well, someone who's been very, very outspoken about that and has shared the same sentiments is the DA. Mr. Jack Bloom, the DA has continuously said the bill as it stands is not necessarily constitutional. What do we mean by that?
Well, first of all, doctors would need a certificate of need. It restricts their freedom to trade. There's also freedom of association, because it basically is going to outlaw, if it's fully implemented, the private medical aid industry. And I can tell you that the real effect of this is that it just opens the floodgates for massive corruption. It's basically forming an Eskom for healthcare. So you can imagine all the sort of people who are just waiting to get their hands on this money, and it would likely destroy the private healthcare as well as won't fix public healthcare. The big question really is, why can't we fix public healthcare? This is a government that can't run public hospitals. Now they've decided they're going to, giantly expand the system with huge amounts of money flowing in. And I must tell you, many doctors are just going to emigrate. People are going to leave the sector, and both private and public healthcare is just going to go down the tubes.
Well, there you have it. We're also hearing there that the DA, in fact, will be speaking right outside the union buildings as soon as the president signs in the National Health Insurance Bill into law. For Newzroom Afrika on Channel 405, I'm Veronica Makhoali outside Mill Park Hospital in Johannesburg.